On this episode of my AfroWorld Sickle Cell Project, I am visiting Oscar Birmingham, a center that also provides support for sickle cell sufferers. Also, in Nigeria, the government is providing a free bone marrow transplant service for sickle cell sufferers. I will be speaking to a specialist at the Sickle Cell Foundation in Nigeria, Dr. Ajibola Sonda. Back in Birmingham, and I am with
Ajay Datani. I'm the current chairman of Oscar Birmingham, and I'm also a patient and client. Although my client file has been closed for many years, while I've been on the board, I haven't really needed that level of support. My job really is to, I sit on the board with two other board members, and we take care of the kind of governance and the future planning of, how we will finance the projects that we deliver and continue to raise awareness. Right now, as it stands in 2015, we're down to 2 part-time members of staff. So we are truly a small charity. Oscar Birmingham started off as a real grassroots organisation led by parents and carers. Now, some of those foundation members went on to start other organisations elsewhere. So we have sister organisations in Sandwell, we have one in Dudley, we have Oscar in Leicester, and so on. And then we also have the Sickle Cell Society down in London. So a lot of those foundational members started this movement to really improve, to raise awareness within the community, to help people understand what sickle cell is, but also to hopefully have an impact on hospital services and improve care standards. So that's what we've been doing for the last 40 years.
Places like Oscar Birmingham are created to provide respite for sickle cell sufferers and their parents. Symptoms of sickle cell anemia can have a significant impact on the quality of their life. This sickle cell is a life-limiting illness for which there is no cure at present.
There's good news. Just because your child is about to be born with sickle cell or thalassemia, it's not the end of the world. We're living in a time where our health carers has furthered us along, and I believe the better your health package is, if you have a good wraparound service from a child, you will have a healthier childhood. It will still be rough. There will still be times where we can't escape from that pain, but whereas say I had a really bad childhood, and a lot of people in my age group, we went to hell and back. But now, healthcare has progressed, pain management is more structured, and preventative medications are in place, treatments which can reduce the amount of painful crisis. There's many different types of treatment plans out there. So I believe, it's looking good for the future in terms of our young people. One of our jobs, and I believe some of the former foundation members of Oscar Birmingham, Sandwell, Dudley, Leicester, Bristol, Sickle Cell Society in London, the UK Thalassemia Society, they all, when it's all said and done, outside of charitable aims, it was about just helping those in pain live a more pain-free life, helping them cope with that life. And that's our job. It's my job. It's Harvey's job. It's Leon's job. It might not be in the job spec when you apply for the job, but it's one of the unwritten kind of targets.
Thank you. Over to Nigeria, and I am speaking to Dr. Ajibola via Skype.
Bone marrow transplant is a very huge procedure, very expensive procedure. In some countries, for instance, let me use this you are using. If you were to pay out of pocket, it would cost you 100,000 euros. About 86,000 for the procedure, and now they're doing it for us completely free.
And I asked him how the institute provides a free bone marrow service for the sufferers.
So what we do is the Institute in Rome partnered with Sickle Cell Foundation and Lagos University Teaching Hospital, LUTH. So the partnership is for them to do 40 bone marrow transplant patients for Nigerians here who have sickle cell disorder. And by the time they are done with 40, we would have gained the skill and the knowledge and the technology to be able to do the procedures here in LUTH in Nigeria. Currently, we've done over 40. We've done about 41 with about a 10% mortality rate, which is very good, comparable to any other transplant program in the world. But we are yet to bring technology fully to Nigeria. But as I'm speaking with you, there's a dedicated building in LUTH called E7 that they are building, currently under construction for the bone marrow transplant program. Hopefully by next year, that should start running 100%.
The awareness of sickle cell has created so many solutions that's going to help to enrich the lives of sickle cell sufferers and provide room for them to live healthier lives. In the month of September is Sickle Cell Awareness Month, and it's so good to know that in the not too distant future, the blood mutation that sickle cell sufferers go through will be completely eradicated and they will get to live healthier lives.